So today we're going to talk about brain health. And it's a very interesting subject because how do we define that? How do we define the brain? Well, it's an organ, but it's a unique organ because there is a function to it that has a very medical-based, scientific-based definition, and then there's a very philosophical-based definition of what the brain is. Um, the brain is automatic. It has automaticity. It does things automatically. For example, the reflexes that we have when we touch something hot, we remove our hand, or whatever part of our body is exposed to the stimuli automatically. We don't have to think about it. Our heart receives messages from the brain and increases its rate of beating without even thinking about it. But then again, the brain is what's called the seat of our being, our consciousness, and what we think, what we remember, what we feel. And different areas of the brain have different functions. So it's a very interesting subject. A lot of people in the medical field might say we are a body that has a soul, and some people in the philosophical area might say that we are a soul that has a body. And they're interesting definitions because they converge in the brain, the seat of our being. The brain's function does change over time, and it changes a lot of times for the better. For example, emotional component and our feelings mature over time, and we become or can become more at peace as time goes on. There's also a biological function of the brain that changes over time, and it, like all organs of the body, will age and change. Sometimes that's reflected in the cognitive function and how we think and how we remember, and we can see that in certain diseases like dementia. And there's a progression to that. And there's sometimes something called mild cognitive impairment that is actually maybe normal. Not everyone has it, but it sometimes is a fact of aging of the brain that we don't learn as quickly, we don't remember as quickly. It can be quite benign, but in other circumstances it actually can be a predictor of dementia. Not a majority of the time, but it does occur. The things that do affect aging of the brain are the things that affect aging of of other areas of our body, and mostly things that would affect vascular or circulation and oxygen delivery to the brain. For example, things that would affect hardening of the arteries, like diabetes, for example, high cholesterol, high blood pressure, and other environmental things that might increase stress. So these are all interrelated in terms of how the brain is affected and also how the brain is interconnected. The things that predict good brain health also predict longevity, and those things are probably best categorized as the genetic predisposition, things that would affect our disease progression, like the things that I just mentioned. But about 2/3 of those determinants are lifestyle choices, like smoking and drinking and eating too much and weighing too much. So those things are controllable, and we should keep an eye on those with certainly an eye towards the future, as we say, in controlling those risk factors. So a very interesting subject and can be discussed at length. So I hope that's a good introduction for you, and enjoy reading about it with the materials that we provide.